This is an educational video to demonstrate our new proning protocol here in SKU at Maine Medical Center. Before you prone a patient, you should have a basic knowledge and understanding of ARDS, why proning can be successful in these patient populations, and when to prone. To prepare for prone positioning, the primary nurse should perform oral care, Foley care, and a four-eyed skin assessment. Proper dressing and skin care should be completed, including shaving of the face and applying skin barrier to all portions of the face and high pressure point regions of the body. Prophylactic Mepalexes should be placed on the elbows and knees and all other high pressure areas, which can include the breasts, chin, or forehead. RT and nursing should remove the Hollister and secure the ET tube with the designated tape which can be found in the proning kit. All of these interventions should then be documented in the proning flow sheet. The patient's gown and all pillows and blankets should be removed. Tube feeds and all non-essential lines, including the A-line or blood pressure cuff, peripheral IV lines, and EKG leads should be disconnected and properly capped. Your patient needs to be properly sedated, and additional sedation or neuromuscular blockades should be discussed with the care team. An attending or a fellow designated by the attending needs to be at the bedside during the prone or supination process. The number of care team members to properly prone or supinate will differ depending on the size and stability of your patient and the experience of the staff. You should have at least 1 to 2 RTs, the attending and or fellow, and 2 to 4 nurses or CNAs on each side of the patient. Team member roles need to be discussed and announced, like who's in charge of the central line, who will reconnect the EKG leads and A-line when we're finished. The RT or whoever is in charge of maintaining the airway should always be the one to count and say when you're ready to move to the next position. Move the bed away from the wall and remove the headboard. Make sure your ceiling lift is in working order and you have emergency airway supplies readily available. A single dry flow should be placed over the patient's groin. An open flat sheet should be placed on top of the patient, followed by the lift pad, starting at the patient's shoulders to allow for proper airway management throughout the prone position. Note the position and securement of all essential lines. Foley catheters should be placed on the bed, and any other essential lines below the patient's waist should extend out of the bottom of the lift pad, including chest tubes. Any essential lines above the patient's waist should extend out of the top of the lift pad. Note that here we are going to demonstrate a swimmer's pose, but if for whatever reason the patient cannot tolerate this position, the prone pillow may be used as discussed with the care team. Roll the bottom sheet and lift pad onto the top sheet and lift pad to create a swaddle or burrito effect. And now, let's roll.
We're going to move away from the ventilator and then flip towards the ventilator on 3. Is everybody clear with on 3?
Yes. Yep.
You always prone the patient towards the ventilator.
Let's go away. 1, 2, 3.
At this point, you want to make sure that everything is okay and everyone's in place before you turn.
And is everybody ready to flip?
Have you guys tucked as much as you can?
Mm-hmm.
Yes.
We're going to go on 3. 1, 2, 3.
Notice here how the nurses are reaching underneath the patient for the bottom portion of the
Everybody's
rolled
good?
pad.
1, 2, 3.
RT will then turn the head towards the ventilator.
Remove the top sheet and lift pad and reattach EKG leads and A-line to ensure hemodynamic stability before placing the pillows. Ensure proper alignment of Foley catheter and male genitalia when you're in the prone position. RT will still be in charge of the airway and counting as we lift the patient to place pillows to support the chest and pelvis and offload the hips.
Yes.
Go up on 3. 1, 2, 3.
The number of pillows may differ depending on the size of your patient. We are supporting the chest and pelvis to help offload pressure of the abdomen. You'll need probably 1 to 3 pillows placed horizontally for each region. 1 to 2 pillows will be placed vertically under the patient's hip on the same side the patient's head is facing. Bend the knee and support the leg with another pillow. Extend the same side arm upwards towards the patient's face, making sure to not overextend the shoulder or elbow. Support the opposite side with pillows to offload pressure points such as the toes. The patient's face should be laying on a dry flow or sheet, not a pillow or towel. Ensure proper position of the ET tube and make sure the eyes are closed, the ears are not rolled over, and the nose and NG tube do not have any added pressure. Place the patient in reverse Trendelenburg, and before you leave, say, "Does this look comfortable?" Obtain an ABG 30 to 60 minutes post-prone. 1 hour later, and every odd hour, you will perform a micro-turn. Remove the pillow from underneath the patient's hip. Extend that leg downward and support it with a pillow. Perform range of motion and readjust the patient's arms. Again, ensure the ET tube is in proper position. Oral suction as needed. Make sure the eyes are still closed, the ears are not rolled over, and there's no increased pressure on the cheeks, and reapply barrier film. Every 2 hours, we will reposition the patient to the other side. Bring all extremities back to a neutral position. Again, the amount of team members will vary depending on the patient, but you will need at least 3 people.
1, 2,
Someone
3.
to maintain the airway and 2 others to run the lift and position the pillows and the patient. Still using the counting method, raise the patient in the lift pad. Switch out chest and pelvis pillows if needed and add pillows vertically to the other hip. Turn the patient's head to the other side. Then, again, using the counting method, lower the patient
Ready?
back to the bed.
Down on 3. 1, 2, 3.
Again, you will want to ensure ET tube alignment. You want to make sure that the eyes are closed, the ears are not folded over, and there's no increased pressure on the cheeks. Also note them checking the pressure points that may be added from the central line. You may need to reposition the patient slightly to make sure you are safely and accurately placing the patient in the correct position. Again, bend the leg on the same side of the patient's head is facing and support with a pillow. Extend that same side arm up towards patient's head. Place in reverse Trendelenburg. Ensure there are no high pressure areas. And again, before you leave, ask, "Does this look comfortable?" We are now going to demonstrate how to supinate a patient. It's basically undoing everything we just did, making sure there is an attending and/or fellow designated by the attending at the bedside for this process as well. Remove all pillows and place the patient in a neutral position. Remove all EKG leads and non-essential lines. Place a dry flow, a flat sheet, and a lift pad on top of the patient. Roll the two together to swaddle and/or create a burrito effect.
So up on 3, and then we'll go this way.
You may need to reposition the patient up towards the head of the bed to make sure that the head is in a neutral position.
Ready? Towards the vent on 3. 1, 2, 3.
To supinate, you move
Up on
towards the
3.
ventilator,
Everybody's ready?
and then you will turn the
1,
patient away
2,
from the ventilator.
3. Pretty good. And down. 1, 2, 3.
We slide the patient back into a neutral position onto the bed. Remove the top sheet and lift pad. Reconnect EKG lines, A line, and any other lines you may have momentarily disconnected for the supination process. Perform a 4-eyed skin assessment and document any concerning areas that may have had increased pressure during the proning process. Add pillows and reposition the patient as you normally would in the supine position. Monitor SpO2 and obtain an ABG within 30 to 60 minutes post-supination.
I'm gonna go over how to tape an endotracheal tube in preparation for proning a patient. First thing, if the patient has a Hollister or a securing device with any hard plastic, that device needs to come off. And we're going to go to a cloth or a soft tape for that purpose. We are moving towards trying to get away from going around the patient's head for obvious reasons. It can be difficult to tape the tube. There's fluid shifts and swelling. It can be a problem for the patient. So today we're just going to demonstrate one way of possibly doing that without going around the patient's head. So whichever corner of the mouth, or if it's in the center of the patient's mouth, whichever corner doesn't matter. You just want to get your tape as close to the edge of the patient's mouth as possible, and it's going to require some cutting of the tape eventually. You can roughly cut it to get it the correct size for your patient, and across the cheek, and I call them little courtesy tabs on the end to make it easier for your co-workers to get the tape off when the time comes. Obviously you want to have somebody holding the tube to make sure it's not getting away from you. Check your depth before you secure the tube around. So this case, this patient's case, we're going to be 24 at the lip. And I'm going to make sure you don't wrap the pilot balloon in your tape. Get several wraps. If you work your way up the tube, it's going to help with securing it as well versus wrapping the tape on itself. If you've ever had a patient where the tube slides in and out of the tape, this will help prevent that. So that's kind of your initial piece. And make sure you're not taping on the earlobes, and you've got a nice secure fit across the face. Our second piece is going to be identical to the first, but we're going to come across the opposite side. And again, we'll trim this up when we're ready. And this time I'm just going to take the bottom piece and come across, up and across, and again a little tab on the end. And your top piece will come across the top lip. I don't know if you can notice, sometimes it's good to alternate which direction. We may want to come, since this time I went this way, you may want to come around and go the opposite way just to give yourself a little bit more securement. And again, don't get your pilot balloon caught in the tape. And if you have enough, again, try to work it up the tube. And making sure, again, we're not on earlobe. And then you can, as for added security, put just a regular full strip. Sometimes I would cut this down so you're not taping over the nostrils, obviously, but I would cut this down to make it shorter, less wide.
I'm going to tab on the side just to make it easier to get everything off. And you should have a pretty secure tube there.